2018 saw a major package of bills to combat the opioid crisis get signed into law, the expansion of short-term health plans, and the start of Medicaid work requirements. In 2019, the Trump administration and Congress will go after pharmaceutical companies and hospitals to lower healthcare costs. We'll also see Medicaid expansions be contested in the states. Here are some of the top things we're going to be watching. Late in the year, a federal Texas judge struck down the Affordable Care Act, which could have ripple effects throughout the entire healthcare industry. Medicaid expansion, the Trump administration's drug pricing measures, and the Medicare payment systems are all based on the Obamacare structure. The decision is likely to be appealed. This decision could have major impacts on drug pricing, which will continue to be a hot topic now that Democrats are in control of the House. They'll likely introduce legislation to allow Medicare to negotiate prescription drug prices directly with drug makers. The new chairman of the Finance Committee, Senator Chuck Grassley, is also expected to focus on encouraging generic drugs to market. The Trump administration is expected to release a rule that would allow Medicare to pay what other countries pay for drugs. Additionally, the administration is going to release a rule that would change the way drugs are paid for as they go through the drug middle managers. Middle managers aren't the only focus to lower healthcare costs. Hospitals will be in the crosshairs as well. The battle over site-neutral payments and an effort to stop surprise medical billing will be lawmakers' main way to lower healthcare costs in 2019. The Medicare agency finalized a regulation to have Medicare stop paying more for the same type of service in hospital outpatient departments than in doctors' offices. Almost immediately, hospitals and other healthcare groups sued the HHS to stop it going into effect on January 1st. Lawmakers are also starting to push against the practice of expensive, unexpected doctor bills known as surprise billing, which has affected more than half of all Americans. 2018 saw a bipartisan group of 6 senators introduce a bill to protect against these practices. House aides are also preparing to push legislation in the new Congress. Medicaid waivers and expansions are again expected to be at the center of debate. Republican legislatures and governors are trying to block Democrats from expanding Medicaid next year. Outgoing Maine Governor Paul LePage has been stalling a Medicaid expansion the state voted for in 2017. The Idaho Supreme Court will hear a challenge to the constitutionality of a ballot measure that would expand Medicaid. And Arkansas started to roll out work requirements for Medicaid recipients this year, dropping coverage for at least 16,000 people. Work requirements will likely expand into Indiana, Kentucky, New Hampshire, and Wisconsin in 2019. Bloomberg Law will be closely monitoring these developments and more in 2019, so be sure to follow our reporters and coverage.